yes, it is almost always safe for patients to exercise throughout their treatment and their cancer trajectory. So, of course, always check with their healthcare provider, but it's safe to exercise before surgery, after recovery from surgery, during chemotherapy or immunotherapy, during radiation, and even throughout survivorship. So there's a lot of good evidence that exercise or being physically active is safe. It does also help fatigue, quality of life, anxiety, depression. If patients have lymphedema due to the surgery they've had for their cancer, exercise can help with that. So there are really a lot of well-known benefits to being active. Sometimes we're nervous on, how to talk to patients because we don't really have a good exercise program ourselves, and we don't really know what to say. So there's really helpful advice out there. The American Academy of Sports Medicine has excellent exercise and cancer guidelines that are available, and I think they'll be linked with the video, and they talk through different types of exercise and how much exercise, and they're really patient friendly and clinician friendly. But overall, don't be intimidated, or don't worry that it has to be a formal exercise program or with a trainer or at a gym. Really, any type of activity is good, and not even thinking about it as exercise, but just being more physically active. All physical activity and all exercise is good. So whether it's a walk or a bike ride or, a swim, Tai Chi or Zumba, whatever, yoga, whatever it is, it's really helpful. And even better, take a friend with you, a family member, go for a walk and you can chat and talk. Take someone to Zumba with you, and you kind of get that win-win benefit of being active and, getting to spend some time with, friends and family as well. I think the most important thing that we can do as nurses is to ask our patients. We don't always talk about, how active you are, or, what are you doing to keep yourself physically active. So just adding that into your assessment is really, really important. It can open up that conversation with patients and get the discussion going. Once you ask them, as you're talking to them, find out, have they ever exercised throughout their life? If they have, what did they do? Are they exercising now or doing anything that's physically active now, and how they can kind of build on that to progress and do a little bit more. Help them plan short-term goals. Even going for a walk 3 days a week is very meaningful. So, kind of work with them to develop a plan. They can combine a little bit of resistance exercise with their aerobic if they would like to. And again, that doesn't have to be with a trainer or at a gym, although you could certainly do that. But it's, lifting a few cans, or, just doing something at home. If the weather's turning bad or it's not so nice out, they can walk around their house or their, apartment building. They can go to the grocery store and walk up and down the aisles, or go to, a mall or a shopping center and walk there as well. So they can get creative in, how they're able to do that. And then just follow up with them at their next visit and see how they were, how they were able to make out with their plan. Was it too much? Was it not enough? Did they like what they were doing? And just give them that encouragement and that follow up that they need to help them maintain their physical activity status. There's such huge benefits for patients. It's really something that should be a part of all of our clinical encounters with patients. There's just a wealth of not only the physical benefits, but also the psychological and mental benefits, emotional, the social benefits. Exercising with friends or family is so important. And we really get that win-win benefit of, all of those, the physical, the mental, the emotional, and social um, benefits of exercise. So it's really something that we should encourage our patients to do, and follow up with them and see how they're doing, and just help them maintain that throughout their cancer journey.